My name is Barry Frank Harris. I'm a general surgeon at Carrollton Surgical Group here as a part of Tanner Medical Center. As a part of our group, we offer a fairly broad range of services from treatment of skin and breast and colonic malignancies to routine treatment of hernia repairs, gallbladder surgery, emergency surgery, these kinds of things. Specifically in my practice, I enjoy advanced laparoscopic surgery. Some of the things I do that are maybe a little less common amongst other folks in my profession would be laparoscopic inguinal hernia repair, for example, laparoscopic adrenal surgery, single incision laparoscopic surgery, some of the things that are relatively fresh and new in general surgery. They can expect to be treated with respect. They can expect to be greeted in a courteous fashion. They should be able to expect standard of care answers to their questions, a full explanation to whatever concerns they have about what they're facing. When patients come into the office, I think they will be treated in the way that I would want to be treated if I was going to a physician's office. The thing I enjoy most about treating patients is seeing someone who is ill, they're just really not feeling very well, or they're very anxious about some recent diagnosis that can be quite devastating. And being able to be with that patient, talk to them, help them with their anxiety about their disease process, as well as watch them get better, fix their hurting XYZ, take their cancer away, do whatever you can to make their life better. And being able to see somebody go from start to finish and to feel better and to feel more like they used to feel before they got that diagnosis, that's probably the most enjoyable thing about surgery. I think probably the most important thing involving patient care is to put yourself in the place of the patient. Sometimes when you're seeing patients, it's at the very worst time of their entire lives when they're having to undergo surgery or they're in the hospital. And putting yourself in their shoes, how would you feel if you had to be treated with their diagnosis? I think treating them with care, with respect is important, and also knowing the current standard of care. I think it's extremely important to constantly be reading the literature, talking to your colleagues both here in town as well as out of town, being up to date in your knowledge base so that you can provide people the latest in what is necessary to help take care of them the best way you can. And also, you really have to tailor that. What is standard of care for a 55-year-old may not be standard of care for an 85-year-old. And so tailoring that individual approach to patients using what is the best available in medicine is probably the most important thing.